Hi Garth, it's nice to see you here at the elevators. If you don't mind, I would like to take this opportunity to brief you on a study that I've been working on or have been looking into, and this also reflects our department as well as our census. I've noticed that our census has been slowly climbing up, and I feel like this isn't due to more people coming in. It's also due to the prolonged time that our patients are having to stay over just to wait for results. This does include the 2021 National Patient Safety Goal, which involves critical lab results and procedure diagnostic in terms of delivering the results in time or promptly so that providers can determine the diagnose or if the patient is not at risk of anything. There is a delay in the process that we are currently using, which is a phone-based, pager-based system. And as we know, when we get a patient, we usually draw blood and the blood goes to the lab. Once the lab technicians run it through, the results usually get input into Epic. And then if it's critical lab results, the lab technician will then call the nurse, and if they can't even get a hold of the nurse at the time and there's a delay there, and if the nurse receives the results, the nurse would then have to page or call the provider, which who knows when they might respond. So there's another delay there. And when it comes to critical lab results or diagnostic procedures, if there is a delay in results, this can also result in the patient needing a higher end of care when they're in the hospital, meaning that our patient that came in with like chest pain or whatnot, where they were admitted and meant to go to just the regular tele floor, because of the delay, now they might have to wait for a step down or an ICU bed, which will take longer. So their time here in the ED will definitely be longer. I've looked into studies where they've used a secure automatic messaging device that are sent to providers. Because many of our providers walk around with phones in their pockets, I feel like this messaging application can definitely do us good in our department. And this works when once the lab results, this has to do with lab results, critical lab results, diagnostic procedures. Once it goes through and they figure out the results, it automatically sends the providers a message on their phone through a secure app. The provider is then able to check on it, acknowledge, read, and then they could even send orders online or get it on the computer, and which will have better outcomes for our patients, knowing that their results are being read and seen on time. And a study that I've looked into in regards to this topic is where they had used a secure messaging application and sent results directly to the provider's phone, where the provider gets instant notification. And like I said, they were able to acknowledge and read the results as well as put in orders. They had noticed from 1,100 results, they had noticed that there was a 42% increase in providers responding in the respondent's time, where reading and acknowledging it took only seconds when it came directly to their phone, whereas if we had to page or call them, who knows, it could take like minutes to maybe hours in trying to reach them. That's why I feel like it's very important for us to probably incorporate this type of secure messaging application for our providers here in the emergency department. This will hopefully help us decrease the patient's time as they spend here in the ED, also decreasing their costs, as well as providing diagnostic on time and also treatment time as well. Not just that, but we can also add more support to Epic. It doesn't have to just be the secure messaging application. It can also be putting in alarm and a time setting on the lab results or diagnostic results, setting off when it's available to whenever the nurse has to turn it off for acknowledgement, as well as the provider has to turn it off for acknowledgement. Just simple things like that will help us improve our patient care and quality, and the quality of care that we give to our patients, and will also decrease the amount of stay that they have to be here for in the ER. So if you do have time, maybe I'll email you and we'll set up another meeting time to thoroughly go through this study, which can really help our department. Thank you.